Let me maybe first start by thanking really the three speakers, Dan, Nicholas, and Alexander. And I'm just reminding that this was in the context of discussing one of the topics that the mHealth Hub is focusing on, which on the integration of mHealth into health systems. And I think what we have been seeing through the three presentations and the discussion, that while we've been talking about that since a while, but still it's a relatively new topic, because there are still a lot of things that we still need in terms of countries and at the regional level to try to sort out. So there are still a number of issues. From the technology perspective, I think Dan has given very good insights about the interoperability, the reusability, the secure digital identities, even cross-border interoperability. And there are so many things that Estonia has been able to do, and some other countries that other countries are still in the process of doing so. So this is a big area of continuing, discussion and trying to nailing down what are the right approaches. And then a lot of other issues when it came to the sustainability and the which is a very critical, and the sustainability and scaling up, and without having a reimbursement system which is based on a good assessment framework, we don't see how we can scale up and how can we create viable business opportunities. And I think from the discussion, it seemed that there is still not like one model that fits all, or like very clear common approaches. There are probably a number of considerations that countries can consider, and to some extent countries need to do their own decisions, but also not starting from scratch. And I think this is a necessity to have this sort of discussions and sharing of information, which, as I mentioned, should not stop here, because obviously we could have started for another couple of hours easily, if not more, as a discussion. And that's why we're trying to do in the hub this knowledge tool about integration of health systems. I think Balance presented the framework, and we have trying to identify all those components that countries needs to consider in terms of interoperability, patients empowerment, patients education, assessments, etc., etc. And what we are really trying to invite the whole European community is try to contribute to this type of knowledge tools. And the objective of the knowledge tool is not to say this is the model that needs to be applied, but rather to say here are the list of questions, issues that should be considered, and this is how other countries have gone about it, and it is for you as a country to try to figure out what needs to be done. And I think one of the implicit objective also of this knowledge tool is to put the right topics on the table. This is the list of things that you need to consider, hopefully quickly in an accelerated manner, so that we can move ahead and scale up mHealth. So I think it's a very rich discussion that we are trying to capture in this knowledge tool, but more importantly, we are inviting you all to contribute to this types of knowledge tool, which by no means it will be an end product, because those topics are still, there is a lot of unknown in many of those topics, and that's why it is intended to be a live document. It's intended to showcase where are we now in terms of thinking, in terms of the European region, regarding all of those topics, and try to provide some guidance how to go about it, how to approach these types of integration issues. So we are very glad that I think we're gonna have a lot of things to kind of capture and learn from those types of discussion. And this is just our first webinar. As a reminder, we have other 5 webinars that are planned, so we might come back to some of those topics in the future webinars.